Without further ado, I would like to introduce again Richard Stack.
Thank you, Pascal, and thank you for the invitation to be here. My background, I'm a physician. I ran the interventional cardiology department at Duke for 25 years. That's the technology that came about in the late 70s that allowed us to move from what was then the largest major operation, highest volume major operation in the country was open heart surgery. It allowed us to move from there to taking just small little needles into the blood vessel of the leg and to put first angioplasty balloons and then later stents into. We were among the first 8 to learn of angioplasty when a fellow by the name of Andreas Grunzig invented that. He invented it in Europe, but then came to Duke and to other places in the United States and realized that he could not really develop this technology in Europe. And so Andreas had to come to the United States, took a position at Emory, and once it got into the United States, exploded. So he was the pioneer, and then quickly to follow on the heels was a fellow by the name of John Simpson. John Simpson taught us how to steer those various devices anywhere we wanted to in the heart, and then subsequently the body of the patient, just opening up a whole new world of what we call minimally invasive therapy. That's literally now benefited millions of American patients and saved lives. During my tenure of running the interventional program at Duke, my greatest interest, in addition to all the responsibilities, was inventing various things. So these guys that I mentioned were my mentors and very close friends, and I'll mention that they worked very closely with the companies they were associated with. So Andreas with USCI, John Simpson actually started the ACS company. That became such a big company, it went from ACS to Guidant and then was acquired for $27 billion. So John did great with that. Myself, I was engaged in various interventions with numerous companies. In fact, have over 100 patents, developed over 70 products sold worldwide, to the point where they had to create a separate full-time conflict of interest committee at Duke just for me. But the key that we initiated at Duke right from the very beginning were 2 things. One, full disclosure. So every single agreement, every word of everything was disclosed to Duke. And then we mutually agreed at the very get-go that I would have nothing to do with acquisition of product by any of the companies that I worked with, 0. It was completely taken out of my hands. And we did that before it was in vogue to do it. We did it from the beginning. And you know, we never had a problem, ever. And a lot of good things came out of that. But I have to tell you, right now, everything that Andreas did, everything that John Simpson did, would be prohibited. That technology would never occur. And not only the life-saving techniques of interventional cardiology, but all the minimally invasive technologies that followed. So minimally invasive surgical techniques, minimally invasive orthopedic techniques, all of that would be prohibited, because I guarantee you every single one of those major breakthroughs were created by physicians, because those are the folks on the front lines. They're the ones with boots on the ground that know what we need to do to overcome these life-threatening problems.